My name is Kirsten Rupp. I am initially from Lincoln, Nebraska. I went to undergrad there and then went to medical school here at the University of Nebraska. Then for residency, went out and trained at the University of Utah. So I actually don't have any healthcare providers or anything in my family, but even from a young age, knew I wanted to do something that really helped people and got to work with people. And then in school, really honestly was interested in anatomy and the science and biology. So felt that healthcare could blend those two things together, helping people, and then the stuff that I found really interesting. So kind of went from there. My specialty is primary care. I do internal medicine, pediatrics, so all ages primary care. And I really like that because working with people, you get to really get to know people of all ages for a long amount of time, and you're kind of people's first go-to, so you really get to know them on both a personal level and then impact them that way. So I really liked that, developing relationships with people over a long period of time, and primary care is a really good way to do that. If you're coming to meet me for the first time, it's kind of like an established care visit, and basically I kind of treat that as two parts. One part will be that I really want to ask the patient or you questions to get to know you, both from a medical standpoint and a personal standpoint, and then also will take a lot of the visit to kind of address your goals and what you want to get out of the visit, both short term, like what do we need to get done today, and then long term, what do we want to see with your health over the next few years even. So it's really for us to get to know you and then kind of see where your goals are going forward. The path in academics that I really like is the teaching, and so the position that I'm in is really nice because I'll get to be in clinic seeing patients, but also working with lots of learners. So whether that be medical students, I'll get to do lots of work with residents, and I feel that teaching aspect that this position brings is really cool because if you're working around learners, I feel like it helps me continue to learn, it helps them continue to learn, so it's just a really nice environment. So when I'm not in clinic, what I like to do with my spare time, I like to hang out with my husband. We have two small boys, so we like to get outside when we can. We like to go hiking, which is really fun. Personally, I like to read, cook, and also really into sports, so like watching sports teams and playing pickup volleyball when I can.